Across the state of Texas, the calls for help just keep coming.
I've never seen anything like this before.
Fear is the biggest part of this disease.
Paramedics in Fort Worth stretched to their limits.
So to us, everybody that we come in contact with, we automatically treat as if they're COVID positive.
I just think that sounds exhausting.
It is. The days are longer, the weeks are longer.
Texas recording 105 COVID-19 deaths on Thursday, the state's deadliest day so far. More than 9,600 people are hospitalized with the virus statewide.
The coronavirus is spreading so rapidly across the state of Texas.
Governor Greg Abbott warning next week's numbers will be worse, ordering the suspension of elective surgeries in dozens of counties and reminding Texans to follow his statewide mask order or risk another shutdown.
The only way we can prevent Texas from being shut down is for everybody to adopt this practice of wearing a face mask.
The surge in cases could also delay the reopening of schools in August by at least a month.
Well, initially that was a backup plan that I had, but now that backup plan is becoming more of a reality.
For those on the front lines, fighting the virus comes at a personal cost. Paramedic Jason Reed spends his own money to stay at a hotel so he won't infect his teenage son.
And even when I'm home, me and my son used to be really close. We'd always sit real close to each other. And since this whole COVID thing's been going on, I make sure that we stay decent amount of distance from each other just because I'm afraid that I would potentially give it to him if I bring it home with me.
He's got to be so proud of what you're doing.
I'd like to think so.
I imagine when you go on these calls, these people must be incredibly afraid.
They are. Fear seems to be one of the largest things I'm finding in my patients, and I'm having to sit them down and explain to them what to expect, what's going on with their body. They're scared. I mean, they really are. And sometimes the only thing they want to do is to go and talk to somebody about it and have somebody tell them that they're okay right now, and these are the things to watch out for. They want knowledge. They want information.
Some of these people, I understand, don't want to be taken to the hospital because that's where the sick people are.
Yes, a lot of our patients are scared to go into the hospital. They're scared that's where COVID is, and that's where they're going to catch it if they don't already have it.
As the summer goes on, do you worry about just the fatigue of it, of wearing down? I mean, this shows no signs of stopping anytime soon.
I do worry about it. I worry about the fatigue of the crews, of everybody in EMS, law enforcement, fire department, because we're all in this together. But we're trained and we're bred that no matter what, we're going to see this to the end. We're going to be here no matter what until this thing's over with.
Garrett joins me now from Fort Worth, Texas. Garrett, we just heard from a paramedic who says he's staying at a hotel to protect his family, his son. These guys upending their lives to help people. After spending time with some of these first responders, what are they telling you? What are their biggest concerns?
Well, you heard some of it. I mean, part of it is protecting the people who are closest to them. That one paramedic talking about protecting his son. One of the other paramedics I interviewed told me that 2 of her sisters had been diagnosed with coronavirus, and that even in her own family, before they had gotten sick, there had been doubts about whether this was really as serious as it was being made out to be. I mean, these paramedics are on the front line of this every day. They know how serious this is. They're trying to make sure that people in their orbits take it as seriously as they do. And then I think the other interesting part of it is they don't know when they go out on a call most of the time exactly what they're dealing with. I mean, they'll get calls that are COVID calls, somebody who either knows they're positive or thinks they're positive, and that's why they dial 911. But even if they're responding to a car accident or a gunshot or a construction accident, when they show up, they have to treat those people who they are treating as though they are COVID positive. I mean, that's just, imagine being operating at that level of stress and fear all day long, every day, for months now, and only getting worse as Texas gets further into this surge.
Yeah. Garrett, I also want to ask you about Governor Abbott's warning there about a possible shutdown if people don't start following the guidelines. Any word from officials on any new restrictions?
No new restrictions yet, but the governor's tone has been kind of changing over the last couple of days, and it's been interesting to watch. He does lots of interviews every day, usually with local television stations. And just over the last couple of days, as the spikes have been getting worse in Texas, he's been talking more and more, almost threatening the idea that a statewide lockdown like what we experienced here in April could be coming back if the numbers don't get under control. He said he thinks next week's numbers will be worse than this week's. But now that there's this statewide mask order in place, he's really banging this drum, trying to make sure people follow the mask order and warning them that the masks are essentially the only protection the state has against the economic ruin that could come with another shutdown, much less the protection they provide against physical illness from everyone across the state who's now keenly aware of the spikes that we're seeing here.
Such great reporting today. Garrett Haake, thank you so very much.
Thanks, Allison.
Personal protective equipment in high demand once again. Healthcare workers say they are running out of supplies. Some of them are even reusing equipment for weeks. NBC News correspondent Joe Fryer has more.
Nurses hitting the streets near Houston, demanding more PPE.
The patients are asking me, why am I not wearing what they would call a moon suit? They're asking me, where's my equipment? And I'm telling them that this is all we've been provided.
Across the country, healthcare workers say they're dealing with a shortage of masks, gowns, and gloves again.
I've, for example, used the same 95 for about 2 weeks now.
A recent survey of nurses found 85% are still being asked to reuse single-use PPE.
I don't feel like a hero. I'm certainly not treated like a hero.
California nurse Amy Arlen says she was given a gown that says it's not for medical use and that her hospital, like many others, is using reprocessed N95 respirators.
We should not be having to fight these battles. The battle we need to be fighting is helping people get better.
It's reminiscent of shortages early in the pandemic when a nonprofit called Get Us PPE was created.
By not actively getting protective equipment to healthcare workers in need, we're getting my colleagues sick.
Dr. Megan Ranney, the group's co-founder, says requests have soared the past few weeks.
Are you surprised it's still happening in July?
So honestly, I'm not surprised. It's all free market and it's all really expensive. And until we develop better national strategies for knowing who needs it and getting it to them, we're going to keep facing this problem.
The American Medical Association is among those calling for the president to invoke the Defense Production Act to make more equipment. But the Trump administration says supplies are adequate in most states.
PPE, we hear, remains very strong. Our focus is to make sure our states have everything they need when they need it.
And Joe joins me live now. Joe, what types of facilities have the greatest need right now?
Well, Allison, we should know we reached out to several bigger hospitals here in Southern California, and they tell us they feel their PPE supply is sufficient right now. So a lot of the big hospital chains in some of the states feel like they're doing okay right now. But remember, they're not the only ones who need gowns and masks and gloves. There are a lot of places in need right now. We hear about, prisons needing it, smaller hospitals, rural hospitals, nursing homes, people who work in home health care, and most recently, school nurses. Think about all the schools that are going to resume in some form or fashion in the coming weeks. A lot of those nurses have reached out to that Get Us PPP organization saying they're having a hard time finding supplies or finding affordable supplies. On top of that, the American Medical Association has been telling the government that they're hearing from a number of doctors' offices and specialists who have been closed during the pandemic but are now reopening or trying to reopen. And all those offices, many of them say they too are having a tough time trying to find this protective gear. Allison?
Joe, and if the Trump administration is saying that supplies are adequate in most states, how do these facilities plan to get more? How can they get more?
That's a big question right now, and some people don't know exactly what the answer will be. We know there's calls for more of sort of a national strategy on this. We've seen the American Medical Association and others say they want the president to invoke the Defense Production Act to produce more. Right now, there are no plans for that. Vice President Pence said this week that right now the guidance from the government is to try and reuse and preserve some of the equipment out there. Some of those like N95 masks that are being reprocessed or decontaminated at night and then reused over the course of days or even a couple weeks. But as you heard there are nurses, healthcare workers, and nurses unions who don't like that idea. They say it's a sign that there really is a shortage out there and production really needs to pick up. Allison?
Joe Fryer, thank you so much. Some positive data on the coronavirus treatment remdesivir. The maker of the drug, Gilead, says 74% of people who got remdesivir recovered by day 14. NBC News medical contributor Dr. Kavita Patel joins us now. Dr. Patel, thank you so much for being with us. Your reaction to this news about remdesivir, what do you make of it?
It's incredibly hopeful, but I say that with caveats, Allison, and it's we need to see more controlled data, meaning we need to see trials that really compared using remdesivir with those that didn't. The data that got released today was just looking kind of over their shoulders backwards, what we call retrospective data. But it is an incredibly promising sign, and I'm hopeful there are plenty more treatments and other things that we can do to help decrease the chances of you even going into the hospital.
What kinds of questions do you still have? What kinds of things do we still need to learn about remdesivir?
Yeah, so number one, we do need to understand if once we do kind of these controlled trials, and by the way, those trials are being done. We're expecting to get some of that data from the NIH itself. We need to understand that in those controlled settings, could this actually decrease not just death in severely sick patients, which is what was released today, but even patients who are not as severe, so some of those with milder illness. And then we also could use more information on how long you need to use this medication. And then finally, Allison, it's not so much a question for the drug maker, but we need to ask our federal government how we're going to make sure that hospitals have an adequate supply of this drug and some of the other promising treatments that we're getting early data readouts from. Yeah.
We still also need to learn so much more about the virus, especially the range of symptoms. Here's what Dr. Fauci said about that today.
I have never seen a virus in which the same pathogen with little change has a range from no symptoms in up to 40% of individuals, mild illness in others requiring virtually no care, others going to bed at home for weeks, others having symptoms that persist for weeks and months.
Dr. Patel, do we know any more about why the virus attacks people so differently?
We have some theories about it. Number one, people with a certain blood type actually have some protection from this virus attacking their immune system so broadly. We do think that there are some indicators of enzymes in our body that are genetically triggered, which can promote kind of a quote, more severe response. Having said all that, Allison, not only is Dr. Fauci correct, but other health ministers in European countries have described this as a deceitful virus. Once we think we understand something, it deceives us. And I think that that's the key here. So we should be very cautious about making statements that we know everything we need to know.
A viewer has a question for you about masks versus face shields. They'd like to know, is a face shield an acceptable substitute for masks? And which one do you think people should be wearing right now?
Yeah, so right now we just have very little data about face shields. Having said that, people are starting to look at whether a face shield can be better than nothing. And I think the answer is a face mask, especially one that covers the nose and mouth, is really going to be the best use of an everyday mask. But especially for some people who can't wear a mask, or if you need to be able to read lips, if you're hard of hearing, or if you're looking at giving something to children, especially younger age children, face shields might be a good alternative. And I do think that in the next weeks to months, we'll start to see more data to tell us, could face shields be an option? And then to your question about what kind, the most important aspect of any face covering, Allison, is something that covers the area of the nose and mouth. So it needs to at least get below your mouth and chin. And again, remember, there's still room to get particles in under the shield, but it is better than nothing.
Yeah. Dr. Patel, in Texas, ICUs are filling up, and NBC News is now reporting that some people are waiting hours or days to get a hospital bed. What is your advice for people who hear things like that and may be afraid to go to the hospital in an emergency?
Yeah, this hits home, Allison. My parents, who are in that high-risk category, are sitting in San Antonio, Texas, and so are many of my medical school classmates. That's where I'm from. And they are all telling the same thing that I'm going to tell anybody listening now. Number one, Do not hesitate if you feel like you have symptoms, an emergency. We have incredible healthcare personnel who are going to do everything they can to make you safe. Having said that, if you're not sure whether you really need to go to the hospital, I would absolutely take advantage of a lot of the telephone call triage centers, video visits, which are still a very good way to see a doctor and let them look them over. Those are the important things to think about. And then finally, be prepared if you do need to go to the ER or the hospital that you will not be able to bring a visitor in, and do all the things you would do to take care of yourself inside the hospital to make sure that you've got your hands clean, that you don't touch surfaces. I know that sounds strange, but hospitals can be very chaotic, and you just need to have as much information before you go. But do not neglect going into the hospital. We know that there was an increase in patients with heart attacks that might have even died at home because they were nervous during the surge in New York to actually go to the hospitals. And I worry that we'll see some of that in the rest of the country.
I certainly hope we do not. Thank you for the good advice there, Dr. Patel, reminding people still go to the hospital in an emergency. Thanks so much. Doctors and nurses on the front lines of COVID-19 are intubating people daily and watching many of their patients die. And they have an important message for the public. Take this virus seriously.
This is real. This virus is serious, and it's making people seriously ill. And it's putting a large burden on our healthcare staff and our healthcare system as a whole.
In Florida, we're seeing increasing cases, so the burden is getting increasing. It's heartbreaking when you have to admit a child who has coronavirus. We've been very, very fortunate that most children do very well with this disease, but that doesn't mean they don't get sick.
We're seeing patients in their 30s, patients in their 40s, patients in their 50s, patients really of all ages, whereas at the beginning we were seeing much older patients, the nursing home patients.
Just imagine not being able to breathe. You can't even get out of bed without losing your breath. So you go to the hospital and we admit you and we put you on supplemental oxygen, which means you either have a tube in your nose, you have a really uncomfortable mask on, or you might have a tube down your throat. And you're in your hospital room and every single nurse or doctor or staff that comes in looks like an alien because we are dressed head to toe in PPE. We have respirators, face shields, gowns, masks, gloves, hairnets, the works. And you're probably scared and anxious, and worst of all, you're alone.
I'm amazed at the morale in general of our staff caring for these patients. These are people who dedicated their lives to healthcare. They never expected this challenge, but they've taken it in stride. So it fills me with pride to see what the team has been able to do.
We're there trying to protect our community and heal our patients. We're putting ourselves at risk. We're putting our families at risk because that's what we have been called to do. And we do it happily. But all that we ask is that you take this virus seriously.
I want to tell the public, our friends, our family, the community to do your part. Be vigilant, practice social distancing, wear your masks. This is a full effort on the entire community. All of us are involved and everybody's responsible. And if everybody does their part and is safe, then we can overcome this pandemic and resume our normal lives.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.